The breasts tend to undergo very predictable changes in massive weight loss, right? Because anybody that used to be large breasted will tend to have still a significant amount of skin, but now the breasts are droopier. A lot of times with massive weight loss, the nipples will even start to point towards each other or just straight down towards the floor. And even women that may not be large breasted to begin with will a lot of times suffer significant changes to the shape of their breast. So now you are losing a significant amount of that femininity, a significant amount of that kind of attractiveness in terms of your trunk. And it can be very distressing to many patients that come in and see me with these things. There's a number of options that are available. I'm going to give you the key concepts that we're going to be wanting to think about and to talk about during consultation so we can really create a plan just for you. In general, when it comes to breasts, we're talking about two things. We're talking about size and we're talking about shape. In terms of size, if you feel the overall amount of breast that's on the body is too large, great, we'll do a reduction, no problem. If you feel it's about right, then we're going to be talking just about shape, maybe a lift. And if you feel that the breast is too small in general, or you want a lot more fullness, you want cleavage, upper pole fullness here, then we're going to be talking about adding volume, which can be done with either fat transfer, which is permanent, all natural, very soft. The only downside to it is you can't add in too much. It's more like a cup to 2 cups. Or we're doing it with an implant, in which case we can add in as much as you like, and it gives you a very dramatic improvement, especially to the cleavage in the upper pole. And so if you're looking for that type of appearance, it is excellent for that. So after we figured out which size we want to make you, then we're going to talk about the shape. Most of the time for patients that have had massive weight loss, where you've lost between 15 20% or greater of your total body weight, we're almost always going to be talking about a variation of a lift. You don't have to have a lift, but it's one of those things where it is a great option if you feel that you want to make the breast perkier, if you want to put the nipple back up at the center of the breast and you want to reposition the breast to sit higher up on the chest. If those are things that are appealing and you find those things more important than having scars on the chest, then in that situation, a breast lift of some sort is going to be the right choice for you. There are a number of my patients that come in and they have just a little bit of that breast droopiness, and the breast tissue still high quality. There's not a lot of stretch marks, and a lot of times we can get away without doing a breast lift. But that is something that's really, really custom, and we'd have to discuss that during the consultation. But in the meantime, those are the concepts that I want you to keep in mind as you're thinking about it, what things are available for your breasts.